Welcome back to Public Affairs on Peach. This week we are talking about men's health, and this segment we want to zero in on specifically prostate cancer. To learn more about prostate cancer, Atlanta urologist Dr. Walter Faulkner is here at the table with us this morning. Thanks so much for coming in. With Georgia Urology, right?
Correct.
Okay, no one wants to hear those two words. My grandfather died of prostate cancer at the age of 75, but this was back in the 80s when we didn't have some of the treatments we have now. Take me through first of all, let's start with warning signs that you might be dealing with prostate cancer or issues with the prostate.
Yeah. Well, prostate cancer is the most common cancer among American men, and this has a very prevalent disease in our population. Unfortunately, most men in the early stages of prostate cancer have no warning symptoms. They're totally asymptomatic, so it's only through routine screening that we can identify those patients. But if they do have symptoms of difficulty with voiding, blood in the urine or semen, those could be signs of early prostate cancer as well. And then advanced prostate cancer, if the patient has weight loss, bone pain, those type of systemic symptoms, they're definitely warning signs that the patient should be evaluated.
There seems to be a tipping point with a lot of cancers. There are some exceptions at which it's, I don't want to say preventable, but they can keep it from coming back in a lot of cases. In other cases, it's gone too far where it's invaded the rest of the body. Where is that medium on prostate cancer?
Well, I mean, it has to do with staging and
Right.
the early disease. If you can identify the disease when it's localized to the prostate, only within the capsule of the prostate, those men have a high potential for cure. That cure could be either through surgery or radiation or freezing the prostate. So we have a host of different treatments that are available now.
And on average, if you're going every year to the doctor and getting screened for prostate, would that be able to keep it within that?
Yeah, the recommendation is screening on an annual basis. That includes PSA, which is a blood test, that's a screening test, as well as a digital rectal exam, which is the rectal examination to feel the prostate for any unusual areas.
So is there anything you would notice on your own that you could tell, like, women, they can have lumps in their breasts when they have breast cancer? Is there anything like that for prostate cancer, or is it just pretty much you got to go to the doctor?
It has to be symptoms and signs, and that's, again, the unfortunate nature of this is the early disease. They don't have any signs, but if they do have difficulty with avoiding these types of symptoms, it does serve as a signal to be evaluated by a physician.
When it is contained to just the prostate, what is the survival rate on it?
It actually is very good in the early prostate cancer. If you can pick the disease up in the early stages, the survival rates are 95% to 100% and through surgery or the conventional treatments that we have available.
Do most of the time, if it's contained to the prostate, is chemotherapy a treatment and radiation that's also used, or is it just surgery, or how does that work?
Yeah, not chemotherapy for localized prostate cancer. The standard treatments are either the surgical removal of the prostate. Typically now the standard of care is robotic prostatectomy or the removal of the prostate via scope. But we do have an application of radiation, either the placement of radiation pellets or seeds in the prostate or external radiation, and then freezing the prostate as well. There's also a large segment of the population that are now considering active surveillance because prostate cancer is a very slow-growing disease. There are some men, depending on their age at time of diagnosis, will tend to follow the disease along with random PSAs and biopsies to assess for any advancement.
Are there any certain sectors of the population that are more at risk for prostate cancer?
Yeah, we see men of African descent. That's the highest risk group in the United States, and also men who have family histories of prostate cancer. What's interesting, too, we have a subset of men who served in Vietnam, and so we've seen some exposures to Agent Orange as increasing the risk of prostate cancer.
So chemical exposure could be causing some issues as well. There's an old line out there that it skips a generation. Now, that's an old wives' tale, obviously. Is that any truth to that?
It's probably not. I tell you, we haven't identified a gene, for men who have family history, but we do see these trends in families and probably a genetic predisposition. We've just been unable to identify the active gene, like your grandfather.
Yeah, I asked because I'm actually interested in that. My dad didn't have it, okay. But my grandfather did. There was a recent study in New Zealand that recommended some aggressive treatment through surgery and a wait-and-see attitude. Tell me about that.
Well, it's kind of the thinking of the American Urological Association as well. We believe in aggressive treatment as urologists. So there's, again, a subset of the population that want to consider active surveillance. So a lot of men are using some natural things as well. They're not recognized by the American Urological Association, but the recommendation, just as New Zealand and the United States, is aggressive therapy through surgery, radiation, cryotherapy, some
It's not
active
something to
treatment.
mess around with.
It really isn't.
Okay, if people need to get tested, what should they be doing?
Well, see, they're either a primary care physician or urologist on an annual basis to get a PSA as a screening test and a digital rectal examination.
Starting at what age?
The recommendation is at age 50 and age 40 if you're African American or have family history of prostate cancer.
Okay, good to know. Thank you so much for coming in. Very informative stuff. Hopefully you don't get it out there, but if you do, hopefully it's caught early. Men's health isn't just physical health, it's mental as well. And when we come back, we'll tackle the issue of depression when we return.